Pop quiz number 10. A client admitted with inflammatory bowel syndrome, Crohn's disease. When planning care for the healthcare team, which would be included? Select all that apply. All right, guys, how do we treat select all that apply? You have to treat select all that apply as true or false. Let's go. 1. Lactulose therapy. False. Who gets lactulose therapy? People who are constipated. What's going on in Crohn's disease? In Crohn's disease, the patient's GI tract, the lining of their GI tract is inflamed. There's inflammation going on. Patients got abdominal cramping. They've got excessive diarrhea. And usually they're malnourished because who wants to eat when they've got all this stomach pain and they have diarrhea all over the place? You're not going to want to eat, so they tend to be malnourished. So this patient does not need lactulose. They're already pooping all over the place. 2, high fiber diet. Again, false. Who do we teach high fiber diet? Patients who have constipation. This patient's already pooping all over the place. They don't need a high fiber diet, so that's false. 3, high protein milkshakes. False. What's in those high protein milkshakes? Milk products. This patient already has inflammation going on. They already have abdominal cramps. You think they need milkshakes? Absolutely not. 4, corticosteroid therapy. True. Why corticosteroids? Well, what do corticosteroids do? They decrease inflammation. What is Crohn's? Inflammation of the GI tract. So yes, the corticosteroids are going to help decrease that inflammation. Absolutely true. And last, what does number 5 say? Anti-diarrheal medications. Yes, because this patient has diarrhea, excessive diarrhea. So we're going to try to calm down that GI tract. We're trying to get rid of that diarrhea because something you got to remember, base comes out the butt, right? So patients got diarrhea. They're losing fluid and electrolytes. That causes a whole other set of issues that we're trying to avoid. So we expect for the patient to be on anti-diarrheal medications and corticosteroids.